Bethany TV for health.
A very good evening to you all wherever you're watching Bethany TV from. Welcome to Medical Minds. It's Teacher Zita once again together with Dr. Anna, but today on Bethany TV. Our topic of discussion is very simple, understanding the basics of infertility. Now, you might be wondering what we are going to talk about. It is so plain, very easy, as I told you earlier on, that in this show, in this discussion, we bring things practically right before you. Welcome to the show. As we start on the discussion, please feel free to join us. This is Bethany TV. It's exactly 8 p.m. I'm Teacher Zita together with Dr. Anna today, and we are discussing, or we are going to talk about infertility. Welcome aboard wherever you're watching from. Please feel free to join us in this discussion. Doctor, good evening to you.
Good evening, Teacher
Welcome
Zita.
back to the show once again.
Thank you.
Everybody's excited and waiting to
too.
listen to this discussion.
Me too.
Say hello to the viewer.
Yes, good evening, viewers.
Okay, thank you so much. Doctor, not to take a lot of time,
Yeah.
today as you can look at Medical Minds, we are going to look at infertility. Yes, infertility is something that everybody has been waiting for. They want to hear what causes it, what are the treatments, why is it so common these days. But before we go into details, kindly in your own word as a medical personnel, describe what infertility is.
Yeah, it's a very good starting question because we have to understand what we are talking about. So we talk about infertility when a couple, that's a man and a woman, have been trying to conceive and they are failing to conceive in 12 complete months. That means
that is 1 full year.
1 full year. That means they have been trying, which means they are staying together. They are having sexual intercourse on a regular basis. Regularity is defined as at least 3 times in a week.
Okay.
So if we verify all those situations and after 1 full year of trying, and they are not using family planning,
True.
they are not yet able to conceive, then we say they have infertility. Remember, I'm talking about a couple.
A couple
Yes.
living and staying together.
Yes, so infertility should be defined for a couple, not for one person.
Okay.
Yes.
Thank you so much, Doctor. In your own words, so infertility in brief is the ability to fail to reproduce.
Yes, the inability to get a pregnancy in a period of 1 year of trial when they are not using any family planning methods.
Thank you so much,
Yep.
Doctor. Let's look at it in this way. Where does the infertility rate lies mostly? Is it in men or women?
Yes, so surprisingly, when we will be discussing about the causes, these are distributed equally in both sexes. We'll be discussing that. It is, I think, the influence of our culture to have us perceive that infertility is more in women than in men.
Okay.
That's not completely true. That's not completely true.
Okay.
Yeah. So, and in our population, we actually have a very high prevalence of infertility. The evidence we have from the preliminary assessments is that nearly about maybe 20 or 30% of our population suffers delay to conceive or delay to achieve a pregnancy in some way.
Okay.
So, which is about 2 to 3 couples out of 10. So, if you move on a particular day and you attended like 10 wedding parties, yes, about 2 or 3 of those couples will be having challenges of conceiving in the next 1 year.
I understand.
Yes.
What could be the possible causes of infertility, especially in young couples? At least we know when someone is grown, their years have gone, but in the young generation, what could be the common factors actually, the common causes contributing towards infertility?
So when we assess couples who come to visit us with infertility, we actually find out that in about 30% of them, the problem is a tube problem.
Tube, that is in women?
In women.
Okay.
So in about 30% of the cases, it is the tubes which are usually blocked. And in about another 30%, the problem is the sperms. There's a problem with the sperms. Either sperms are too few or they have some abnormality. And then another about 10%, the problem is in both the sperm and the tubes have issues. Yes, and in some cases we find the issue is the womb. The womb for some reason either is scarred or has some issues which makes the pregnancy not to be sustainable.
Okay.
Yes, but in some percentage, like about 10%, we find you can't find a reason. You do all the tests and everything is normal, yes. So we say it is unexplained.
Okay. Doctor, before we go so far, what causes those blocked tubes in women especially, the scars and because at times someone says I have blocked tubes. Blockage of tubes. In our population, the commonest cause is usually infections. The commonest causes are usually infections. What type of infections are those?
Infections into the tubes come commonly because of miscarriages, abortions. People have pregnancies which they don't want, and then they go ahead and they remove their pregnancy. And then they get infections after that. Okay. Lately, we are beginning to see some cases of endometriosis causing blockage of tubes. Also, that is one of the causes. But also, some people still get STDs in our population. We still have gonorrhea, we have still chlamydia in our population. So, STDs cause blockages of tubes, even after treating? Yeah, because most cases of STDs, for some reason, people present late. Oh, yeah, they present late. By the time they're discovering it has it has already caused some damages. Because you see, sexual transmitted diseases, they have some bit of stigma. People don't openly come out, true. And so it shows that maybe they have had some sexual issues, and then they are coming up with this infection, and so they delay to come for treatment. Yeah. I understand. Let's talk about the low sperm count. Yes. Especially in men. What causes that? The low sperm count. Yeah, so the low sperm count, as I told you, in our population, about among our couple who come for treatment, about 30% of them have issues with sperm. Yes. Now, the low sperm count, in some cases, we're able to identify the cause, the underlying cause. In some cases, we're not able to identify. We just look at risk factors. But common things which show up is that some men have had viral infections in early childhood. Okay. There are some viruses which destroy the testes. When a child is still young? Yes, so commonest to be mentioned is mumps, and that's why it was a very good idea to really promote vaccination against mumps. It's now among the things we vaccinate against. But people used to get a lot of mumps. It is a mild infection, but later in future, it shows as low sperm count because the viruses go and destroy the sperms. That is in the male child? In the male child. Do we have an illustration for us to see a few things that you're talking about, especially the blocked tubes? Yes, so if we, maybe now since we're talking about the sperm count, so to confirm that somebody has a low sperm count, usually we have to examine in the hospital. We have to examine their sperms, and so we have the laboratory person will show us that the sperm count is low, and you will see something similar to this actually. Yeah, these are nice. Okay, so over here, this is how a normal population of the sperms will be like. I hope it appears. So you find them crowded, and usually when they give the report, it's about 15 million or so. That is released during the